In the United States, approximately 1.2 million people are living with human immunodeficiency virus, HIV. About 1 in 7 of these people don't know they have the virus. HIV was first identified in 1981. Not everyone infected with HIV will have the same symptoms, and some individuals may not have any symptoms. Symptoms depend on what stage of HIV infection the person is in. Stage 1, acute HIV infection. Within 2 to 4 weeks after being infected with HIV, 2/3 of people will have a flu-like illness. These symptoms are the body's natural immune response and can include fever, chills, sore throat, fatigue, muscle aches, swollen lymph nodes, rash, night sweats, mouth ulcers. These symptoms may last a few days to several weeks. Unfortunately, these symptoms are similar to symptoms caused by many other viruses. About 1 in 8 people in the United States who have HIV do not know they have it. The only way to know for sure whether you have HIV is to get tested. If you know you are at risk situation with an HIV-positive person and develop these symptoms, you should get tested immediately. Knowing your HIV status gives you powerful information to help you take steps to keep you and your partners healthy. The second stage of HIV infection is chronic HIV or asymptomatic HIV infection. In this stage, the virus still multiplies, but at very low levels. People in this stage may not feel sick or have any symptoms. Without HIV treatment, people can stay in this stage for 10 or 15 years, but some move through this stage faster. Without a HIV test, many people do not know they are infected. Over time, the immune system becomes damaged and weakened by HIV, and symptoms develop. Initially, they can be mild, but they do worsen. Symptoms include fatigue, weight loss, mouth ulcers, thrush, and severe diarrhea. The symptoms are caused by the emergence of opportunistic infections. They are referred to as opportunistic infections because they take advantage of a person's weakened immune system. Some examples of opportunistic infections are PCP, toxoplasmosis, TB, and Kaposi sarcoma. Stage 3, AIDS. AIDS is the final, most severe stage of HIV infection. Because HIV has severely damaged the immune system, the body cannot fight off opportunistic infections. There is no single test for AIDS. Doctors will look at a variety of symptoms, including the CD4 count, the viral load, and the presence of opportunistic infections in order to make an AIDS diagnosis. Without treatment, HIV eventually damages the immune system enough to progress to AIDS. Symptoms of AIDS include rapid weight loss, recurring fever, extreme tiredness or fatigue, frequent, heavy night sweats, sores in and around the mouth, anus, and/or genitals, long-term swelling of the lymph glands in the armpits, groin, or neck, chronic diarrhea lasting longer than a week, pneumonia, discolored patches on or under the skin or inside the mouth, nose, or eyelids, memory loss and depression, neurologic disorders. There are other medical conditions and diseases that also can occur with AIDS. To know more about HIV symptoms in men and women, please visit the link in the description of this video.